So some new thoughts on vitamin supplementation. I'm talking today about vitamin B12, omega-3, unsaturated fatty acids, and multivitamin preparations. These are very important, particularly because of the influence they have on our risk of dementia, and our cardiovascular situation, and our immune system. B12 is a common deficiency over the age of 50 and very much so over the age of 60. Probably 30 to 40% of over 60-year-olds are vitamin B12 deficient. The reason for this is poor intake, poor absorption, and generally a need to deal with the dietary deficiency in older age groups. Probably also worth mentioning the high-risk individuals here, people who take metformin, the anti-diabetic drug, proton pump inhibitors like omeprazole if they have acid reflux, vegans or vegetarian, and people particularly with high folate diets or somebody taking folate supplementation. Now, having a high folate diet is a very good thing because it's dementia protective, but it does mean that you need to balance up B12 as well. So, and if you want to be vegan, that's fine, but everybody needs to have good B12 because low B12 has consequences. I like the paper by David Spence, which says metabolic vitamin B12 deficiency, a missed opportunity to prevent dementia and stroke. And this references the fact that people with low B12 have an increased risk of dementia and an increased risk of stroke. The Alzheimer's disease mechanisms, the things that happen in the brain to cause the damage, many of those mechanisms are strongly influenced by B12. And so there are very good arguments to favour supplementation. A systemic review suggests that supplementation has a positive effect on delaying cognitive decline, and B12 is important, folate is important, and thiamine. Thiamine is vitamin B1. That comes up in respect of the multivitamin I'm going to recommend. B12 measurement is difficult. Well, it's not difficult, it's easy, but there's some debate about the interpretation of B12 measurement. The purists will tell you that because the B12 level in the serum doesn't always accurately reflect what's in the tissues, that you can't use it to establish what's going on. In fact, practically, if your B12 level in a blood test is low, the chances that you're B12 deficient are very high. And we're talking here about the subtleties of research, not necessarily about real life pragmatism. But if you want to really understand exactly what somebody's B12 status is, then you need to measure homocysteine and a compound called MMA to give a clearer position. But, B12 is okay. Now, if you find that your doctor's reluctant to measure B12, well, basically, if you're in an older age group or one of the other high-risk groups, just take the B12. There are no established risks. If you take a bit more than you need, it gets peed out in your urine, and so there is no reason not to. You may, if you happen to scour the internet, come across a reference or two to an increase in colorectal cancer when B12 levels are high. When this has been discussed by experts, this appears to be either related to people taking excessive amounts of B12, or actually probably not that B12 causes cancer, but the situation where somebody has colorectal cancer causes an increase in B12 levels because there's a metabolic disturbance going on. It used to be thought that all B12 had to be given by injection, but actually oral B12 is just as good. And in fact, some countries recommend it over and above. So Canada and Sweden recommend it over and above injectables. You'll still find people in the UK who are fixed on the idea that you have to inject B12. And sure, if you've got somebody old and frail who won't take B12, then you can give them an injection once a month and it deals with the problem. But you're not in that group. And so you can take B12. Because there are probably lots of other pills that you have to take, I recommend taking B12 as an oral spray, and a minimum dose of 1,000 micrograms a day. But given the fact that absorption is probably below 50% of what you administer. My advice for anybody over 60 is that they take 2,000 micrograms a day at least. The preparation that I used, which is called Better You B12 Boost, contains 1,200 micrograms per squirt, and I take 2 squirts a day. You won't do yourself any harm, but you want to make damn sure that you've topped up your level. Zinc and magnesium are very important issues. If you have a diet which is full of green vegetables and lots of seeds and nuts, you can probably get enough in through your diet, but you need to be sure that you've covered this off because zinc is very important for immunity, and the studies demonstrate that people 60 plus generally have a zinc intake that's about 50% of what's recommended. So this is a very common problem, and certainly around 30% of older people tested turn out to be magnesium deficient. Zinc is interesting because it improves blood pressure, glucose homeostasis, and lipids, so reduces LDL cholesterol. That's the so-called bad cholesterol. By the way, you need to know that zinc sulfate is very poorly absorbed, so it needs to be a preparation that is, for example, zinc citrate. And again, magnesium, the preparation matters. Magnesium taurate is the one that I recommend in a dose of 600 milligrams at night time. A glycinate or a citrate, in other words, another organic compound will do, but don't take magnesium oxide. So the omega-3s, this is no longer a fishy story. There's good data to support omega-3s, and it doesn't have to be a fishy aftertaste. Omega-3s reduce inflammation and they strengthen the immune system. They're beneficial for inflammatory bowel disease. There's evidence of benefit in rheumatoid arthritis and a modest benefit in osteoarthritis. People are looking at this as a possible benefit for people with multiple sclerosis, and omega-3s are cardioprotective. And in the written document, I've referenced the National Institutes of Health fact sheet, research indicating that all types of seafood promote heart health. Now, if you take fatty fish, oily fish, 3 or 4 times a week, then that would probably give you enough omega-3, but you probably don't do that. And so I would recommend a supplement. If you're vegan, you might think flaxseed oil would be a good option, but it doesn't seem to get the same amount of benefit that we achieve with the fish oils. And the way around this is that all the fish get their omega-3s by eating algae. Algae are vegan, so you can eat algal or vegan omega-3 oil in a capsule. And there's no doubt that there's some benefit in terms of preventing cognitive decline. And a dose of around 4 grams a day of algal oil is going to be sufficient to have an impact on the issues we're concerned about. That's the cognitive decline, your lipids, and your cardiovascular status. And again, no hazard here with overdosage. And so I take 2 Nutravita vegan omega-3s. Each capsule is 2 grams, and I take 2 a day. In the United States, for example, Ovega is a reputable brand, but the capsules aren't the same strength, so you need to take slightly. All the recent studies have tended to work on a dose of 4 grams daily, and there have been no hazard reported, so that's the dose to go for. Multivitamin tablets, I would have told you 10 years ago that if you were getting a normal diet, you didn't need to take a multivitamin. But actually, there's now data to show that a multivitamin, one particular specific multivitamin, slows cognitive decline when it's been taken consistently over a 3-year period. And this is the Centrum brand. It's the Centrum Silver Adult over 50 preparation. Now, looking carefully at all the various Centrum preparations, and there are 2 or 3 or 4 different ones, they're not all the same. And so you've got to take this particular Centrum Silver Adult over 50 preparation because that's the one that had the impact, and we don't know which of the 10 or 15 ingredients or all of them together are giving you the benefit. And this preparation contains the right dose of thiamine, which is vitamin B1, which is important for us in terms of dementia protection. So those are some new thoughts for you, and some doses and recommendations to make sure that you're protecting yourself as best as you can against dementia, cardiovascular issues, and immune system problems, which of course means an increased liability for cancer and various infections. Thank you.